In 1981, I moved to the Castro neighborhood in San Francisco, really excited about being in the city. And as I went about my day-to-day life, I began to notice young men with lesions on their faces. And we didn't know what it was. Nobody knew what was happening. And then as more and more men got sick, young men, old men, so many people sick, and so many of us came together, families, friends, community, lesbians, gay men, and even some of the local health officials and doctors. But we knew that help was not coming from the federal government. It was completely obvious. And it just was absolutely devastating.
We've made a lot of progress towards raising awareness, preventing, and even treating HIV. But I've noticed that even though our community continues to be disproportionately impacted by it, we seem to have lost focus of the issue. In fact, HIV stigma is palpable in our community, and we've got to keep addressing it. HIV is still our issue, but few LGBT organizations are working on HIV criminal law reform.
You know, we really have to ask ourselves and really think about how it is, not only the broader LGBT movement has moved itself away from HIV as being central, and, you know, which in some ways is, it doesn't hurt HIV because there's a large HIV advocacy structure, but it does hurt the LGBT movement. And it hurts us also because we haven't seemed to be able to maintain a coalition structure that really advances our health and well-being. What community would allow a disease to that is pretty much defined by its population to continue to exist and not speak up about it?
If we are truly committed to racial justice and racial equity, we have to confront HIV head on.
From Equality Florida to Freedom Oklahoma to Basic Rights Oregon, we amplify the power of the state-based LGBTQ movement. And we partner with leaders on the ground. Our 43 members in 38 states are winning equality, town by town and state by state.
With this reach and these strong relationships, we are uniquely positioned to change hearts, minds, and laws to achieve fairness for people living with HIV and to help end the spread and the stigma.
It is unacceptable that HIV criminalization laws fuel not just rates of infection, but rates of mass incarceration among people of color, poor and working class people, transgender people, sex workers, and the most vulnerable among us.
Nearly every state in the country has specific or broad laws that criminalize the transmission of HIV. These laws are based on stigma and misinformation.
Between 2008 and 2016, over 300 people were prosecuted under these unfair laws, some resulting in multi-year prison sentences.
As a Southerner, HIV hits close to home.
Almost half of new HIV infections are in the South.
Equality Federation and our members get things done, and that's why we've set our sights on HIV. We've been partnering with our members as they incorporate HIV into their state-level policy work. We're working now in 3 pilot states, Kentucky, Louisiana, and Ohio, building coalitions between our members and HIV organizations.
I'm Dylan Wagasback, Board President of Louisiana Trans Advocates. We're thrilled to be working with Equality Federation to decriminalize HIV and end stigma.
We're going to raise the visibility of HIV issues in the states through a coordinated national education campaign, building coalitions, reaching underserved communities, making policy change at the state level. Equality Federation makes a difference in the lives of people with HIV.